Makaela Whalen, and I'm a third-year law student at Lewis and Clark Law School and a member of the Animal Law Clinic there, through which I've had the pleasure of working with Anna Stout, Executive Director of Align Care Health. Align Care is a national nonprofit working to integrate pets into public health considerations and address barriers to pet care. Align Care began as a multi-city pilot program working to address these barriers to veterinary services to improve human and animal health, especially amongst lower-income households. Realizing that systematic barriers demand system-level change and building upon the knowledge they gained through their on-the-ground work, Align Care shifted its attention to policy work to address these barriers. Align Care turned to this new direction just last year to formally recognize the human-animal bond as the social determinant of health in Anna's home state of Colorado, which Anna will expand upon in her presentation and which is currently working its way through the state legislature. To say the least, we're very fortunate to have Anna with us here today. In addition to serving as Executive Director of Line Care Health, Anna has served on the Grand Junction City Council and as Mayor of the City of Grand Junction for several years. She is a certified animal welfare administrator and certified court interpreter and ATA certified translator from Spanish to English. She has also served on the Animal Welfare Association of Colorado's Board of Directors and co-chaired its Advocacy Committee. Please note that there will be a limited question and answer session at the end of today's presentation. Please join me in welcoming Anna Stout.
Thank you so much, Makaela, and thanks to everyone who decided to spend your time with us this afternoon. If it's afternoon where you are, it is here in Colorado. And as Makaela mentioned, my work sits at the intersection of public health and the role that animals play in people's lives. And this shows up in a significant way in housing for many pet families, as everybody who's joined this conference today already knows. And as she mentioned, I won't rehash it, but I have a lot of experience in the big P policy space, so lawmaking and policymaking, and in the advocacy realm in general, both on the side of policy making as a policymaker and as a policy mover from within primarily the nonprofit and local government space. So what I want to talk about today is how we use policy change, and in today's focus, how we do that within health definitions to work towards change in our housing systems. And to be clear, from the very beginning, you don't have to be a policy wonk to be here or to get anything out of this talk. In fact, if you're one of the many people who recoil at the thought of having to get involved in politics, especially in today's politics, and you feel like you're most comfortable and most impactful at a service level, know that I've designed this presentation specifically for you today. So my goal is twofold. At the end of this session, I'm hoping that you leave with a reframed way of thinking about this issue, and also with some confidence and a demystifying of the process of what a next reasonable policy step would be that you could take in your own community or state. So let's start with the reality and why we're even talking about this. The reality is that 2/3 of US households are pet households, are pet families. To contrast that, we're not talking about a niche population because less than 4 in 10 households in the United States right now include minor children. So when we're talking about this issue today, we're talking about the true modern family of today's society. At the same time, when you look at our housing systems, somewhere between about 70% and 90% of rental housing has some form of restrictions for pets in those rental homes. In some cases, that's outright bans or breed restrictions, size limits, limits on the number of pets. So from the outset, and the problem that we're working to address through this conference is this misalignment. The majority of people in our society are pet families, and the majority of housing is not designed for that reality in our rental markets. But even when housing technically allows animals, and as Makaela mentioned, I'm here in Colorado, and if you were in a previous chat where our Housing Finance Authority presented from Colorado, they did a survey, and a number of places reported being pet friendly or allowing pets. But even when housing technically allows animals or pets, it comes with additional costs. We know pet deposits can be a few $100. They're usually non-refundable. Monthly pet rents can really take what might be an affordable rental amount and kick it up 20 or 50 or more, and that can be per animal. There are often additionally requirements like vaccinations or documentation about vaccinations that folks may not have access to, especially in rural communities where we have a really acute access to care problem. So even when something is technically allowed, when a pet is technically allowed, it's not always accessible because this functions now as a structural barrier to housing. When we look at homelessness specifically, this tension is much clearer. And depending on the estimates or depending on the study, there's variation, but studies suggest that between about 5% and 25% of people who are experiencing homelessness have companion animals. We also know that many people will decline shelter, and with that, the spectrum of stabilizing programs that come with being in a shelter or having access to sheltering, things like medical clinics or assistance trying to identify opportunities for housing, they'll decline that if it means that they have to separate from their animal. And that is often framed as a barrier. It can be met with a lot of judgment, especially from within the housing, the human housing side or the human sheltering side. But it's deeper than that. And it goes beyond just, a pet as a barrier. What we're really talking about is the other side of this, which is the fact that the human animal bond is a critical component of an individual's life. So it's not just a personal choice or a lifestyle preference. And we are repeatedly hammering that this is not about I'm choosing to be with my pet. I'm choosing not to part with my pet because this is my lifestyle. This is what I prefer. But rather, this pet, this human animal bond that they have with their pet may be their primary source of companionship. It may be the one thing that provides structure, routine, emotional regulation, a sense of safety, a sense of belonging, and can really be utilized as a reason, as an incentive for somebody to engage with services or to maintain some level of stability to be able to maintain that bond with their pet. So what we end up with when we look at this, when we acknowledge that pets can be both a barrier to accessing housing as well as and simultaneously a source of stability and well-being, the frame shifts and how we talk about this shifts because now we're talking about a social determinant of health. What do I mean by that? When we talk about social determinants of health, we are talking about the non-medical factors that influence health outcomes for individuals. These things include housing, transportation, economic stability, social connection, and there are more. And it depends on where you're looking and what you're discussing and how they're defined. But these are some of the most common ones. And we see these primarily defined within the CDC, within Healthy People 2030 guidance. But these are factors that are systems, whether it's housing or human services or our healthcare systems, we recognize these currently as legitimate drivers of health outcomes. And so by recognizing them, it's something that our systems respond to and design interventions for. But the key takeaway and the thing that I want to really reframe today is the idea that if something's not defined within a system, it effectively does not exist to that system. Especially when they're addressing these massive, massive issues that are multi-systemic and complex. If it's not defined within that system, it doesn't get measured. And if it doesn't get measured and it's not acknowledged, it doesn't get funded, it doesn't get built into programs. So even if all of us understand that the human animal bond does affect health and stability, and we don't need convinced of that, And if the people who are working in these systems that we're working within, so our housing policy experts and our landlords, even if they understand it, if it's not defined in policy, our systems cannot generally act on it. And so that's where right now when we're talking about this definition becomes a lever. And so when we define something formally in law, and in our case, we're discussing this as defining it within the definition of social determinants of health, this is what creates legitimacy. This is what creates visibility. And when we have that legitimacy and that visibility, it allows our systems to respond and to design either interventions or responses within those systems. So here in Colorado, where I'm based, we are currently moving a bill through the legislature. I'm very excited about this. We just yesterday found out that we passed the House. This made it through the Colorado House on a 55-8 vote, which is extremely, if you know today's political environment, that's a very high vote. So 55-8, it passed out of the House. It's now moving through the Senate process, and in fact was just scheduled yesterday for our Senate Health and Human Services Committee for next Thursday. So if you're interested, I'll have more information later in the presentation about how you can follow this bill's journey as it makes it through the process of becoming a law. To be real, I don't want to spend a ton of time on our bill specifically because I do want to talk about the advocacy process generally, because this effort may look different depending on the state or the jurisdiction that you're in. But I want to talk about what our bill does and does not do. So very importantly, this bill does not create any funding mandates. This does not allocate any funding from existing programs or from new funding sources to any existing or new program. And this does not require housing providers to make any changes to their policies at this point. Any change that would happen that would change anything that I just said about funding or mandates or anything else would need to go through its own process. So that's what our bill doesn't do. What it does do, though, by actually defining the human-animal bond within the definition of social determinants of health, is it starts this conversation and it allows us to create a mechanism for systems like our housing systems, like our healthcare systems, social service systems, over time, to be able to engage stakeholders, look at additional policy development opportunities, and to recognize and respond to housing, or to name the system, but for today's conversation, for housing as a part of health and stability. So we're taking this out of compassion, we're taking this out of lifestyle, we're taking out of the what's right and what's wrong. We're just going to plug in and say this is not even about how you feel about it. It's about the fact that we concretely know that there are effects on our human health outcomes that pets in the home and pets in people's lives have. And so what then becomes possible once we define the human-animal bond as a social determinant of health is it starts to unlock things. It does not have any automatic changes that would come out of this, but now with the definition rooted in law, we're able to start talking about how to integrate pets into housing policy conversations, how to incorporate it into our public health frameworks, and how to now start building it into existing funding and program designs. And so this definition, really what it's doing is it's creating a legal foundation for advancing pet inclusive housing as a human health consideration rather than a discretionary accommodation. All of that, though, requires next steps. We're going to get into that. I do want to talk about what doors we think we're unlocking that could be part of future policy efforts, and how that could really unfold in ways that meaningfully change this housing conversation and the work that many of you are doing right now. But before we do that, I want to talk about this the whole myth of policy and advocacy. Because it's not useful to you for me to tell you what codifying the human animal bond can do if you're not in Colorado, where we're working on that. So I want to talk about how you do this. And I'll also step back and say that all of this can be generalized. If you're identifying other challenges that you think might have a legislative or a policy fix, everything that we're about to discuss about how to go through this advocacy process or this policy making process, it applies. So you can take this and apply it to any other solutions that you're coming up with. But we're gonna look through the lens specifically of defining the human-animal bond as a social determinant of health. So let's demystify this policy change process. I'll start by saying everyone in this session today has the capacity to do this, to identify challenges, to propose changes based on the policies that are impacting your work and in many cases impeding your work. So for many people, I get it. This feels like a thing that, especially in the nonprofit world, I think there's a lot of unfortunately, I think there's a lot of fear of stepping into the policy process out of concern about jeopardizing 501c3 status or not knowing exactly where those boundary lines are. But I do want to say, if you are working for a 501c3, you are allowed to engage in this kind of policy and advocacy within the legal bounds of your 501c3 status. Now, talk to an attorney if you want very, very specific details, because I am not an attorney, but I do want to make sure that everybody knows that from within the 501c3 space, within the nonprofit space, you are absolutely allowed to engage in policy work. Okay, so for those of you who feel like this is something that happens in marble buildings with by people who are completely detached from the day-to-day of your work, let's break this down into really practical terms. And again, I'm speaking to you from the perspective of somebody who has both been in those marble buildings as a decision maker and been on the other side of the dais, making, giving public comment and making the case for policy change to those lawmakers. Okay, so let's break this down into some pretty practical terms. When I talk about policy, I often refer to big P and little p policy. So big P policy is when we're talking about changing laws, but policy lives in many places. So policy can live in statute, which is law, as I just mentioned, but also our little p policy here. Policy can live within regulations, which are agency rules and depends on the state, the jurisdiction, the agency who makes those rules. Sometimes there is a body, for example, rulemaking for certain laws will go through in certain states, a state board, for example, that's been tasked with that and established for that purpose. Sometimes it goes through an internal process, but those regulations live within agencies. Then there's administrative guidance, which shapes how things are implemented. And then also within program criteria, that's again a policy, little p policy, which determines what services or what programs qualify for funding. And so all of these are potential entry points into the policy change process. So the first thing that we do then is we start by figuring out two things. Where does this issue already live within your system? So where is it and who has the authority to touch this, whether it's to make change, to create change, to repeal. But first we identify that entry point. And so the question that you'll be asking yourself right now is, does my state define social determinants of health in statute? Because not all states do. And while some states, actually very few states, actually define social determinants of health in law, some do reference social determinants of health without an enumerated definition. In other places, it may be part of your public health framework. It may be embedded in agency guidance or program rules. It may be that wherever it lives, it references federal guidance. And so it only lives in your local system in a way that is referring to a different document, whether that's either at a state or a federal level. So that's your first bit of research that you do, is you try to identify where that lives. And then the next thing that we're looking to do is to find who that authority is. And this tells us, once we know whether this lives in law, whether this lives in rules or in guidance, now we're able to then start to figure out who our authority is. So we know our entry point, whether that's through law or big P or little p policy. And I will also mention that in some cases, it doesn't exist. It may be that whatever challenge that you're working to solve does not yet exist, and that's the opportunity that you're identifying. And in that case, you're looking for the place that it would have the most likely home. So now that you've decided, you've done your research and you've figured out where does this policy that needs changed live, or this policy doesn't exist, and here's a place that makes the most sense for it to find a new home. So now you're looking at whether this is something you can move through an administrative process or an agency. That is often faster and more flexible, though it is less durable. It is sometimes less far-reaching. If it's in statute, you're probably looking at legislation, and we're going to focus on that eventuality. So if you've decided that this is where it lives or needs to live, this is what we're going to talk through the how-to of. And this is where a lot of people do get stuck, because the just go talk to your legislator advice, that feels pretty vague, or it feels pretty intimidating, and the where to start can be really difficult. So let's make that concrete, and let's make that feel a little less intimidating. To begin, every state, to begin this process of trying to figure out who you're talking to, every state has a website, and whether you can just Google it, you can do General Assembly of whatever state that you're in, and then you can look up your representatives based on where you live or where you work. See what committees they sit on. I think that's a very important thing to do, is first just know who you're working with. Your representatives, in theory, because they represent you, because you are a constituent, presumably you are a voter, they are your lowest hanging fruit, ideally. But of course, many of us live in places where we're not aligned with our lawmakers, or where our lawmakers have not signaled a willingness to work on the issues that are important to us. So let's just start with our current representatives, figure out what committees they sit on, and all of this should be on your General Assembly website. See what bills they've sponsored in the past, whether they've passed or failed. See whether those bills have tended to be bipartisan or cross-partisan, or whether it has been just within their party. What you're trying to determine is whether or not there is any opportunity for existing alignment. So in this case, when we're talking about social determinants, when I'm doing my research on a lawmaker, I'm looking to see if they have ever worked on or spoken about, or if their campaign websites, which generally they leave up even after they've been elected, doesn't mention anything about public health, doesn't mention anything about housing, about behavioral health, sometimes it's something that's adjacent, but has a nexus. So I'm looking for things like Veterans Affairs, or seniors and aging in place, anything that might say that it's something related to public health or social determinants of health. And so let's say too that you look at it and you're like, yeah, my representative, not an option, not aligned, not an option, or I've had experiences with my rep and I don't think that this is going to work. There's absolutely nothing stopping you from approaching lawmakers in your state who are from other geographic areas, but who are aligned or passionate about the issue that you're working on. And so then again, this is a matter of doing some research. I want to take a moment and plug, controversy aside and opinions about the good or the bad of AI aside, in this case, AI can be extremely useful. So I will make a plug for it here. And I've written a prompt that is a pretty comprehensive prompt that you can use. You can screenshot this, you can download the slides from the Whova site, you can send me a message and I will literally copy and paste and send this to you. But this is a great prompt that I would use to start mapping the landscape and identifying who within my state I could talk to. That's something that AI is actually pretty good at doing very quickly and cutting your research down quite a bit. It is extremely important, though, that you're crafting an effective prompt. And I will also add that there are some, depending on the AI, depending on where you are located, there are some rules about what AI can and cannot do. For example, you cannot ask AI, at least in Colorado, I have encountered this barrier where you'll get AI that gets a little squirrely if you're starting to ask questions about how to influence a specific legislator on a specific issue. So you have to be very careful about how you craft this, but this is a AI safe prompt. Really important, though, that you're using this the way that you would talk to a political strategist or just a friend, right? You're like, hey, I'm working. You start by telling your AI what your AI is. So I usually start with, you are a legislative analyst or you are a campaign strategist. So I will put my AI in that sort of mindset, if an AI can have a mindset. And then you have to be very specific about, here's what I'm working on, here's the purpose of it. Please identify. And so I'm not going to read this entire thing, but I want you to see how much I've put in here detail wise so that I'm not just saying, hey, AI, who are the legislators in my state who are friendly to social determinants of health or who are pet advocates or whatever. In fact, do note on here that I have put on that if I were doing this prompt, I specifically uh, ask not to include legislators who have been prominent in animal welfare legislation. And I can get into that towards the end, but I'll just give you the short version of that. What we're trying to do here is run a public health bill. And this is about public health. We're framing this through human health outcomes. And if we bring all of the well-known animal rights or animal welfare friendly legislators into this bill, it actually may lose some credibility in your public health or your human services, or even in some of your ag communities. So it's really important, I think, to keep clear in your mind that the way we're framing this is for the benefit of human health. Okay, so let's say you've made your short list. You've got a list of aligned lawmakers. Now what? Now the next step is to figure out who you already know, who might be your way in. That may be, you can think about friends you can think about other directors maybe your city council members or your county commissioners are a good way in, because many of your city council and county commissioners are going to be connected to your state representatives, maybe your governor, maybe your senators. Is your city manager a person you might be able to go to? The CEO of the hospital in your community? Just think about your network and think about who you could ask to get you to do the warm handoff to a lawmaker. If that doesn't work, or if you're not comfortable utilizing your network, let me tell you, there is nothing wrong with a cold call. I can tell you that our first two sponsors on the Colorado bill were, the first one was through my network. It was actually he's a state representative from my community. He and I served on the Grand Junction City Council together, so I already knew him, and I was able to sit down with him and present this idea to him, and he became our prime sponsor. But then I identified through the process, the research process, I identified another lawmaker who I thought would be amazing for the bill. And I didn't have anybody. I reached out to friends of mine in Denver, so it's about 4 hours with a whole mountain range dividing us from where I live. So reached out to a bunch of people that I knew and said, hey, do you know this representative? Do you know this representative? And I didn't get anybody who knew her well enough to do a handoff for me. So I did a cold email. And that actually led to her responding, me sharing the information about the bill. And she wrote back, and I think she talked to the other prime sponsor and came back and said she'd love to be a sponsor. So it is a real way that you can access and get in touch with your lawmakers. A thing I want to mention, though, is that it may not be your elected official who is your best first point of contact. You can certainly try, but if you go through the lawmaker, you may be responded to. from the staff side of things. So know that your first point of contact may not be the elected, and that's actually not always a bad thing. And you may get a hold of the elected, and they're going to kick you to your staff so that you can present your idea or your challenge to the staffers. And they really are the ones who do the research, who shape and recommend policy, and advise their electeds on what their policy position should be. And I think very importantly, they're often the ones who decide what and who actually gets to sit down, who makes it in front of the legislator. So think about them sometimes as an executive assistant. Sometimes the executive assistant in an organization may be the most powerful person in the organization because they're determining who actually gets in front of the legislators or not, or in that case, CEOs or executives. You can find staffers on legislative websites. You can call the lawmaker's office from the General Assembly and ask who handles health and housing issues. There are many ways in. And again, this is where the internet is a huge friend. So let's say all of those things still just don't feel like they're landing for you. Think about what coalitions you might be connected to, because a lot of coalitions or organizations who already are working with lawmakers have those relationships. And you can get, sometimes it comes as a stronger ask when it comes through a group of organizations that may have more credibility or just, more aggregate credibility. And then finally, a lobbyist might be your way in. And I want to clarify this about what is a lobbyist, especially at the state level. We think of lobbying as a it can be a dirty word, especially in the federal context. But at the state level, lobbyists really are, in my opinion, relationship experts. And I will, in full transparency, say that I am a registered lobbyist. I do not lobby as an independent lobbyist for anyone. I don't have independent clients, but as the director of an organization that's working on advocacy issues, I register as a lobbyist to make sure that we stay within, that we're above board on all of our 501c3 requirements. But I think lobbyists really should be better understood as relationship brokers. So these are people who understand how the system works. They know who the key players are. They're building relationships with lawmakers across the spectrum. And they know how to sometimes strategically move an issue forward or to move it around or to move it to the right person. Most lobbyists are willing to share contact information. If you reach out and say like, hey, I see that you have worked with XYZ lawmaker, they're usually willing to both provide insight and contact information without you having to retain them. But there are also times that hiring a lobbyist might be the way that you can be more effective by having that person present at the Capitol, being your voice on a daily basis, meeting with stakeholders and reassuring lawmakers and, just kind of being present so that you can keep doing the work that you do every day on the ground without having to be pulled away from that constantly. All right. So now we're at the point where you've secured a meeting with your lawmaker or with their staff. Your first ask is simple. You are not sitting down to ask somebody to sponsor a bill. Rather, you are sitting down with them to educate them, to let them know about an issue that you're working on. And so in this case, hey, I'm working on an issue that's related to housing and to health outcomes. I work for the animal shelter or the homeless shelter or whatever. And I'd really love to share what we're seeing and get your perspective. And so that's it. All you're doing is asking this person to be a thought partner in an issue that you're encountering. And certainly you're aiming towards an ask, but this is not that much different than fundraising. You shouldn't, generally speaking, meet a funder and ask for money on the first meeting with the funder unless they specifically tell you to. And so you're showing up to this conversation to build a relationship. I'd recommend that you come with some data. As much data, I don't overwhelm a lawmaker. They're usually inundated with this kind of stuff. So a one-pager is really great if you can just summarize some of the data that shows it, but then really the stories from within your work that illustrate that this is an issue that's affecting people either in your organization or in your community or within your state. So it's a very important part. I will kind of just again to humanize this a little bit and to show that this is more than just theory. I secured our prime sponsor without intending to secure our prime sponsor. He is a Republican and he is from my community. And so I actually asked him to meet me for coffee so that I could get his perspective on what his caucus might take issue with this idea. So I sat down with him and I said, hey, this is what I'm working on. We do intend to try to move some legislation on this. And I gave him the rundown of what we were working on. And I really was just asking for his thought partnership. And by the end of it, he offered to, not that day, but within a couple of days, he came back to me and said that he was willing to be the sponsor. And that came not as, I guess it did come as a surprise to me. But I think what was really important about that is, remember what we said at the very beginning of this presentation? Almost 7 in 10 households in the United States are pet households. Turns out lawmakers are very similar, and so are their staff. So when I sat down with him to tell him about this link between pets and health, I didn't have to convince him because he has his own experiences. He has a dog, and the first thing he did was tell me about this new dog that he got and how this dog is the reason that he's getting out and running every day. So I say this because I really want to underscore how much of this is a relationship and how much of this is really taking an issue that you're encountering in your work that may not be on their radar, getting it on their radar, and then inviting them to help you find a solution. And if that solution is legislative, and if they're bought in, and if the relationship building is working, they may be the one to offer to sponsor, or to at least be able to connect you to somebody that they think would be the appropriate lawmaker to carry it. So again, the work is relational from there. So once you've established that, you're helping them understand the issue and care about the issue. One big thing that you're going to do is continue to provide data. Here is the information that we know. In fact, our prime sponsor just emailed me on, I think, Monday morning, asking me for some studies that he could cite when he's talking to people. And this is after it's already gone through his half. He's a House representative. So it's already gone through his part, but he's still talking about it. So a big part of what you're doing is providing your lawmakers their talking points, their data points, and helping them care about the issue and framing it around how it's impacting their representative or their constituents and why they should care. You're helping them have a clear way to think about it, how to talk about it. And sometimes you're actually the one, whether it's you or your organization or your coalition, bringing forward draft language and saying, here's what a bill could look like, and here's how the language that's currently in the law could be modified, or here's how we could add this to this part of the law. And that helps show them what a solution could look like. Don't stress, though, if you're like, I can't draft legal language. That's okay, because if you don't have a bill drafter, lawyer, alter ego in yourself, they have drafters at the Capitol. And if they commit to moving this idea forward, they'll sit down with their drafters to put that idea to paper and to start to move it forward. I will really quickly take this opportunity to make a shameless plug for Makaela and the team at the Animal Law Clinic in Portland at the Lewis and Clark College, because it was Makaela who actually did this work for us for Align Care and put together the initial language that we took to our lawmaker. So there are many resources out there, but if you don't have somebody if you don't have an amazing Makaela in your corner, you can rely on their drafters. All right, at this point, you are a partner with your sponsor. So you are now working with your sponsor and really just being available to them and asking them what they need, trying to anticipate their needs. So in some cases, you may be asked to help find co-sponsors, and it may be that your lawmaker says, yeah, I'm down as long as you find somebody from the other party or another somebody from a different geography, but help me find a co-sponsor. And then that's on you. And that was actually the case with my bill, or with our bill. Was Rick said, hey, I'd like you to find a Democratic co-sponsor in the House for me. And also, can you work on one in the Senate? So then you may be in that you go back to step one for identifying that next lawmaker. You draft language, they draft language. If the bill gets introduced, it gets assigned to a committee in the house that it was in the chamber that it was introduced in. So if it starts in the House, it gets assigned to a House committee. At that point, your role is often to support the lawmaker by testifying, by helping organize others to testify, building that coalition and making sure that you've got enough voices there to speak to this issue broadly and in a way that helps everybody on that committee see why this is valuable. Because that committee is the one that will vote to see whether this advances to the full chamber or not. It's debated generally. Often that's where amendments are either introduced by the lawmaker. We had an amendment ready when we went in that morning to try to address some of the concerns we've been hearing. There may be amendments that are offered on the spot, but whatever vote comes through there, if it is passed through committee, then it goes to the full chamber. The full chamber votes. It gets read a couple different times. There are a couple different votes, and then if it finishes that process, then it goes to the next side and it starts over. Throughout that process, you're working with your sponsor to, again, provide them data to work, if they're getting specific concerns, helping come up with ways that can mitigate. You can mitigate it through an amendment. Maybe you can mitigate it through language in your one pager, but you're a partner at that point with your sponsor. All right. So that is the process. That's really your schoolhouse rock, how a bill becomes a law generally, but from not just when it gets introduced, but all the way back to the relationship building, which is the part that, again, I think is for many people that barrier to entry. So let's come back to Colorado. Let's come back to our bill and talk about why we did this in Colorado and why we chose the legislative pathway. I'll start by saying one of the reasons for why Colorado, sometimes policy work and advocacy work there's some luck involved in it or good fortune. We did start in Colorado. There are a couple of states that are we consider kind of primed for this, but a big part of it was the relationships that we already had here, that Aligned Care already had with our lawmakers. So that's kind of step one. But specifically, in Colorado, the reason that we chose a legislative pathway is because social determinants of health are actually defined in statute. So by changing that statute and inserting the human animal bond into that statute, that changing of the law codifies it in law. And so that was really important to us because we wanted that level of recognition, especially with this being the first policy or legislative effort to codify the human animal bond. This may not apply everywhere. It won't be true in places where this is not defined in law. It could still be defined in law. It just may not be the same path where you're simply amending a definition. It may be introducing a definition for social determinants of health in a place that doesn't already define it, but references it. In some places, it may be looking at an agency or an administrative process. But again, the logic is always the same. You find where the definition that you want to work within or where the law that you want that definition to live in, where does it currently live? Who has authority over that area? And then you start the conversations for how you might move that through the system. Okay, so we are right on time here, which makes me a little surprised and very happy. So I want to take a minute. I do everything I can to never give a presentation that doesn't have a component where folks are actually walking away with something actionable at the end of the session. So I want to give everybody who's attending here an opportunity to apply this to your own work and to your own community or state. So we're going to take a few minutes to make a game plan for you in your own state or community. So pull out a piece of paper, or if you need to do this on your notes of your phone, all of that is fine. But try to find somewhere where you can actually put this down. I love lists. I love lists. So we're doing a list. And I want to also say, we're not going to answer these questions today. If we had a longer session, we would spend some time actually doing this research and breaking into breakout groups. But because this is a limited session, we are only creating your to-do list for post-session. So piece of paper out, pen and paper ready. If you're not in a policy role, this still applies to you. So don't feel like this part doesn't apply because this is about actually starting a policy change process. If you are working at the ground level, you are the ones who are seeing the impact on the ground. And so you're the ones with the data, even if that's just anecdotal at this point. And you also have relationships with the systems and the partners who can help inform this kind of conversation. Okay, so your step one on your list of things to do post conference is to do some research. Look up where are social determinants of health defined in your state or your system. And again, feel free to use AI for this, but you can just, what you're looking at is where is social determinants of health defined? Who uses it in my state? And where is this something that exists in a grant program? Is this something that exists within state public health and environment policies? So that's your first step, is just identify again, where does this live? Second thing you are going to write down is you're going to look up your own lawmakers. This is step one of the lawmaker identification process, because first I just want you to know who you are represented by. So what's their name? And you should have a state house, well, depending on your state, depending on your jurisdiction, but you should have a state house rep and you should have a state senate rep. And often there are multiple lawmakers, you know, in our community, for example. I have one specifically, but there are two in this area at the house level that that you know they work on issues that are specific to my community. So it may not be my house district representative, but it's still a representative from my community or my area. So what are their names? What city are they in, so that you know where they are in relation to you if they're state reps? What party are they in? And what do they say their priorities are? And it may be something that you have to glean from, again, their campaign websites or from their the committee assignments that they have, but try to figure out or interviews they've given, what do they say their priorities are? And then very importantly, their contact information. You can pull that from the General Assembly website. Then the third step is if step two didn't identify your aligned lawmaker, then you're going to identify one legislator or committee or agency that you think would have influence over this definition if it doesn't happen to be your representative. This is another place where AI is your friend and can help you start to drill down into that. Hopefully this overlaps with your representative, and step two was, you know, this step three combined in one. But it's okay if not, and go ahead and then write down that person's contact information or the agency contact. The fourth thing that you're going to write down, and again, if we're going a little fast for writing all of this down, these slides are available to you in the Whova app. So the fourth one is you're going to make yourself your step 4 note. What data do you have? Is that something that you have from within a coalition? Is this something that you have a CRM or a shelter software that tracks? Is there something that you need to gather? Because sometimes you're going to need to spend a year or some period of time specifically gathering data to answer the question that you believe your lawmaker is going to ask. Like in this case, if we're talking about housing and pet-friendly housing, you work in an animal shelter, you may not be tracking granular level surrender data. And I'll mention too, I was at an animal shelter. I was the CEO of an animal shelter for almost a decade. So this world is a very familiar one to me. So you may be tracking reasons for surrender, but are you drilling down into the very specific housing related reasons that might give you the ability to hammer this home with a lawmaker even more? Also think about, what are the stories that illustrate this data? There are different kinds of lawmakers. Some are very data driven and some are very story driven. But I can tell you that when it comes time to actually sit down and testify and give public comment about something, it is the stories that stick. So think about what stories you can bring to that meeting with your lawmaker or the agency head or whoever you've identified, and be able to say, look, I want to tell you the story about Larry, who came to the shelter, and this was his situation. And Larry is an illustration of a broader problem that we're seeing. Remember, in this stage, you're not making an ask. And you can lead with that. I often used to do that when I was in fundraising as well, is just say, hey, I'd love to meet. Leave your checkbook at home. I'm not asking you for money. I just want to talk to you about what we're working on. So know that you're sharing a challenge, you're sharing an idea, or asking for them to be a thought partner on how to address it. And then your last step, and this may seem self-serving, but I promise it is not. Oh no, the next one will be self-serving. This one's not yet self-serving. This one is, given what you've just written, what you will have just done, the different research steps you will have just taken, think about what one realistic next step you could take that would allow you to start this conversation. That might be, talking to somebody who who's already involved in the legislative process in your area. It may be looking at reaching out to a staffer. It may be building a one-pager of the data and the problem and kind of framing it, talking to a coalition partner that you're a part of, or just getting your data gathering in order. If you're comfortable with this right now, go ahead and in the Whova app, because we're not using the chat on Zoom. If you joined through the Zoom route, go ahead and drop that in the chat if you're comfortable sharing what you think, not having done this yet, but if you think you've got enough of this in your mind, what might be a next step that you would take? And you can share that in the chat, and please share your state as well if you do so. Okay, here's the self-serving part, but it's not actually self-serving. The sixth step that I'm asking you to write on your list is to write down my contact information and to feel free to contact me. If you want help thinking through strategy in your state or learning more about the framework that we've been developing along with Makaela and the team at the Animal Law Clinic, we are looking at different state environments. We're sort of separating them into tiers of opportunity and trying to start coming up with some strategy for how we can continue to move this through other jurisdictions in addition to Colorado. So feel free to reach out and know that Align Care is here, and we're more than happy to be a thought partner in that. Strategy is our skill, and the idea of how to start doing this and demystifying it and really helping you feel strong as you're and confident as you're walking through this. That's what we want to be for you. So please don't be bashful about reaching out. And now to wrap up, because I do want to leave just a couple minutes of Q&A. As I said before, when we began, codifying the definition of the human-animal bond as a social determinant of health is not the end point. This is the very first step in laying a foundation for broad, profound systems change. This is the beginning of a pathway for us to start moving policies and programs forward that can begin to address many of the barriers we talked about earlier and that have been the subject of so many talks during this conference. So again, this is the beginning. It is codifying the definition is not the be-all end-all, and it does not achieve our goals, but it gives us a legal foundation on which to stand when we talk about this. So I mentioned that we were going to talk about what this could look like, what doors this might open. And so we'll move to that really quickly. I'm just going to plant a couple of them with the caveat that there are so many places that this could go. And so what this might look like would be changing rules and eligibility within housing programs so that they then recognize pets as a part of access, stability, and crucially, health. So this is no longer just a conversation about like, look, pets are important to people. It's pets are important to people and they impact their health. And there's a question that I got before the presentation started that that this answers. So I'm going to get to that question first. But let's keep going. Identifying or creating funding streams within human health funding pools that can support things like pet deposits, veterinary care, boarding for during periods of time that people are having anything that might impact their health, um, or other costs that are currently functioning as exclusions to access to housing. Stronger alignment between housing systems, health systems, and social services would be another one. We'll continue here. It might also be shelter and transitional housing models that are designed with pet inclusion in mind from the beginning. Again, with the underscoring this as a health strategy for people who are moving along the housing spectrum. I think things like offering training for housing navigators and social workers about pet-related benefits, barriers, and solutions, benefits being a key one here. And then potentially reforming current ESA laws to better reflect the American family reality, the modern American family reality, and to reduce what many view as abuse and fraud. So these are some just initial first steps in the housing space. Redefining or defining and codifying the human-animal bond as a social determinant opens many, many other doors that are not specifically housing related, but these are some of the next steps that could come out of this. So what this all comes down to is that if we want housing systems to stop treating pets as a personal choice, a complication, or a disqualifier, we have to give those systems a legitimate legal basis for seeing the human-animal bond as what it often is in real life. It's a factor that affects health, stability, and whether someone can successfully access or stay in housing. That's why this definition matters, because from that legal foundation, we can start doing the real work of changing the policies, the funding decisions, and the program rules that are currently shutting too many pet families out of housing. I want to mention, again, I mentioned Makaela and her team. If you are interested, we are working on a white paper that will very explicitly discuss this and synthesize the research that has been done about the impact of pets and human health. And so if you're interested in that white paper when it comes out, please scan this QR code and we will get you on the mailing list as soon as it's published. It'll land in your mailbox. You can also get updates about Align Care's advocacy efforts and partnerships. So we'll move into, I know there's only 3 minutes of Q&A, but I do want to address at least one that came up again through a private message. And that question was, if I can find it quickly, it was essentially how do you frame this for lawmakers to make lawmakers care? And I will tell you that it depends. It depends on the lawmaker. This is a relationship, right? So I can tell you that with our prime sponsor, with Rick Taggart, Representative Rick Taggart, if anybody wants to email him and show him love for being the one to champion this, as well as Representative Lisa Ferre and Senators Judy Amabile and Janice Rich in Colorado. But for Rick, it was defining this as and again, he's emotionally bonded to his pets, but he's a Republican. And the argument that landed for him was the idea that when people are healthy, they cost our health systems less. He's on the Joint Budget Committee, so he lives and breathes cost and budget and expenditures. So the argument we made to him was, if we can go upstream and we can provide interventions, in this case pets, as a social determinant of health, then those individuals presumably can actually be less expensive to our system and save taxpayer dollars. That's an argument that may resonate with some lawmakers. With other lawmakers, a more compassionate argument might make sense. For some lawmakers, we have a really strong advocate in the Colorado House who was a victim of or a survivor of domestic violence, and these arguments really resonate with her. So it needs to be tailored to your lawmaker and to their priorities. Obviously, there are different aspects of why this matters, and choose the aspect that will resound in their minds the most when you meet with them. I don't know for sure that we have time for many more questions. Let me see if I can just answer one. And the one that got the, I think, most upvotes here is, what is one practical first step communities can take to start framing the human-animal bond as a social determinant in local policy? I would argue that again, is going to be tailored to your community. It may be meeting with your health department and asking your health department to adopt some kind of resolution or guidance. It could be if we're talking local, it could be a resolution at your city council or with your county commissioners. And again, it just starts with that advocacy and the relationship building. So I am thrilled to have had this opportunity to be with you guys this afternoon. And I'm really grateful to be in the presence of so many people working to make a difference in the lives of people and their pets. So thank you so much for your time this afternoon.
Chasing the night away, never judging.